Thank you, Commissioner. Thank you, Governor, as well. And thank all of you for being with us today. Before anything else, I want to echo the Governor's and the Commissioner's sentiments and say a huge thank you to all the students, the families, teachers, staff, and administrators who are committed to this and helping to ensure that we have the best learning experience for our students possible in school this year. This is a year unlike any other, and everyone has stepped up in a huge way to get ready for school reopening. So our journey on that is beginning together, and we're going to continue strong. In terms of our data for today, as the Governor said, we have 86 new cases to report. Our case counts and number of tests done each day over the last week have fluctuated a bit, but our percent positive has held below 2%, which is important news. There are 84 people currently hospitalized with COVID-19 in Rhode Island. Of those people, 9 are in an intensive care unit and 5 are on a ventilator in the state. Sadly, as was mentioned, we have 3 new fatalities to report today. 2 of these people were in their 60s and 1 of them was in their 70s. Our prayers continue to be with the families of these Rhode Islanders and with all the families of the people who we have lost throughout this pandemic. In terms of schools, as has been described thus far, and as we have shared, we anticipate and have been structured and planning for, we've had cases this week. This is exactly what we expected, and given how many students, teachers, and schools are in Rhode Island, we had people in the K through 12 community testing positive in a number that was relatively low. We also acknowledge that people from the K through 12 community have been out and about all throughout the summer. And so this is an experience that had started before school opening and will continue throughout. It's precisely why we have spent so much time building up such a comprehensive testing program and case response program through our COVID unit overall. To tell you a little bit more about the cases, we have identified 8 cases among students, teachers, and staff in schools in Rhode Island through our dedicated K through 12 testing program. Another 11 cases have been identified through other testing modalities in Rhode Island. So that makes the 19 total. For those 11 cases, these people have been swabbed over the last few days. But because we post data when we get the result, these are cases that were posted with our data since the start of school on Monday. Of the 19 total cases that I'm sharing, 7 have been among teachers and staff, and 12 have been among students. Of these 19 as well, 9 actually went to school, and 10 people never went to school. Every time that we had a case over these last 2 days, the Rhode Island Department of Health COVID unit, the Epi-Op Center that we refer to, has been able to respond right away. And that's in direct partnership with our colleagues at RIDE supporting and the Education Operations Center, also supported through our colleagues with the National Guard. There is a system that's in place across all of government that, as the Governor said, you can be confident in. I am confident in, and greatly appreciate the commitment of teams of people who have been working on this. You hear from me, the Governor, and the Commissioner often, but there are so many people across all of government at the state level who are working incredibly hard behind the scenes, night and day, weekday, weekend. We can attest directly to that. Let me give you an example of how the response has been, because we understand that there's a lot of information that's out there. We want to continue to make that information available to you. We want to encourage you to, particularly if you're a teacher or staff person at a school, to check out the playbook that we've put together so people can have an understanding of what happens. The Education Operations Center is there to support schools and be able to answer what happens. Our unit is also there. We want to continue to educate you and help you understand what this process will entail, because cases will occur. The goal here is to get on it right away and stop subsequent cases from happening. That's what we've been doing. These first 19 cases have occurred across just 18 schools, which means we haven't had large clusters of cases occur. Once we have a case, we get on it, we do the things that we know work as part of the system, and we stop secondary transmission from occurring. So an example is that there was a case at Carnivale Elementary School in Providence in the news yesterday. An adult staff person went to school and while at school started to feel sick. Was fine beforehand, started to feel sick. That person went into isolation promptly in the school's established isolation space. Through our dedicated K-12 testing program, that person was scheduled for a test, got swabbed and tested, and the results back all in the same day. The moment that we had that positive result, our team started doing their case investigation and contact tracing work immediately, all still within the same day. And with the kudos to all the teams involved, we will continue to do whatever it takes. So Monday night, we called all the families involved by roughly 10 p.m. At the same time, our partnership with the Education Operations Center was working with the school to ensure that environmental cleaning was being done, to help get the school's questions answered, and to provide the administrative support that was needed. All in all, 3 people from the school, all of them adults, were determined to be close contacts and are quarantining, and we'll be working with them to support them through their quarantine process and get them set up to be tested at the appropriate time, because you need distance between when they've been exposed and when to consider that, and to ensure that they continue to quarantine through the entire time frame. What's key to know is that the school is still open today. Students at this elementary school are still learning today. That's because we were prepared with the systems, the structure, the planning, and the protocols that we need. As the governor said, we're going to continue to learn through this together. We're going to continue to grow through this together and make improvements as we go forward. But it's key for you to have confidence in the work that we can attest to that's gone into making us prepared and into the systems that have been built to make this go forward. Another component that I just want to share with you is how we are going to continue communicating with you clearly and regularly about the way COVID-19 is affecting our school communities. We got into a good rhythm with sharing data every Wednesday in a table about COVID-19 cases in long-term care facilities and assisted living facilities, and our plan is to do something similar with school data. We expect that to be live for you at our press conference next Wednesday. This data update is not intended to replace the direct communications that all schools should be doing to the parents and families in their communities and that we will continue to conduct with schools, but it's an opportunity to provide a statewide glimpse at what's happening from a school standpoint in a way that's clear and accessible for the entire state. Okay, before opening things up for questions, I want to continue to share with you what we're learning in real time from our case investigations overall. Between September 1st and September 7th, we identified 434 new cases. Workplaces continue to be an area where we have some room for improvement with cases. Of the 434 cases, 147 people indicated that they were employed. 86 of those 147 people, or 59% of them, reported working at least one day with symptoms. And we are focused on that. We've done interviews with different businesses, and we know that businesses that do active screening of employees have fewer symptomatic people coming into the workplace to work. We also know that businesses that support their employees to be able to stay home if they're sick and not be concerned about whether or not they can keep that job and continue to get the resources that they need to do that also contributes to fewer symptomatic people in the workplace and fewer cases in the workplace setting. For employers, consider a few things. Consider continuing to screen employees prior to when they are on site. There's a web form that's a great way to do that. Consider using a full symptom list for screening as opposed to just asking about someone's temperature. Continue to post those lists of symptoms and screening questions around your facility, and continue to ensure that it's in the languages that your employees speak. And lastly, continue to ensure that your employees have the support they need to be able to stay home if they're sick, because we know how critical that is. We've seen time and time again throughout this response that some very basic steps can help prevent the spread of COVID-19.